Last but not the least is the intramuscular administration medication. So, before we start the procedure of the IM, we need to perform the 4 steps that we did earlier. The first one is to check the doctor's order. Second is verify the client's identity or introduce yourself to the client and explain the procedure so that the client will know how to participate during the assessment. Next is wash our hands. This is to avoid the cross microorganism. And next is the arrange the equipment that we will be using. But this time, the injection that I am be using is the 3 cc or 3 ml, and the gauge is 22. So, select the site that where you wanted to inject the medication. There are possible 2 IM injection sites, which is the deltoid muscles and the vastus lateralis. So, I will ask the client where he wants to inject the medications. Hello sir, ako na si Erica Lea Navarro. Ako ay mga student nurse for today sir. Pwede mabalin mo pangalan sir?
Reggie Navarro.
So, kamusta man ka sir?
Okay lang.
So, ang i-inject karon sir is imong vastus lateralis, which is diri adapit sa imuhang paa or doon sa imuhang urinary bladder diri sa kilid. So, unsa man ang imuhang gusto na asa man dapit na site ko pwede mag-inject sir?
Dari adapit ha.
Dari dapit. So, pwede ka mo atubang dito sir sa imuhang left side.
Okay.
Now, after choosing the site, examine the integrity and the muscles of the client's site where we inject the medication. And also, examine if there is any tenderness, bulges, lesions to the client's skin or any other skin complications. Ipalpate lang ako, sir, ha?
Okay.
Hindi lang ako igna kay ma-feel ng mga pain.
Okay.
After palpating, we need to wear or apply a clean gloves. Now I already apply a clean gloves. I will look for anatomical landmark to see the site again. Then after that, I will using a V shape like this one to see if the site is to ensure if this site is where the muscle or where I could inject the medication. And after that is or disinfect the area in circular motion, inward to outward. And let it dry. Do not blow again. Let it air dry. So now we have another clean gauze pad. And the use of this is to put it between of our third and fourth finger. Because in case the patient might bleed, we can put it directly after injecting to the client. After putting the gauze between the third finger and fourth finger, I will get now the syringe and remove the cup and hold the syringe between the fourth finger and the thumb. And after that, using the ulnar side of my hand or my non-dominant hand, I will place it just below of the injection site up until I will put the needle or insert the needle. After inserting the needle, I will move my non-dominant hand at the end of the plunger and aspirate or inject the medication. Slowly. After injecting the medication, remove the injection and place it quickly with gauze pad. Remember, do not massage the site to not damage the tissue. After putting the gauze pad between my third and fourth finger, I will now get the syringe and remove the cap and hold it between my forefinger and thumb and holding it like I'm playing a dart. And using my ulnar side of my hand just below the injection site, I put it here and then pull it like 1 or 1.5 inch and insert the needle. Relax lang, sir, ha?
Okay.
And then, using my non-dominant hand, slowly slowly pulling back the plunger. Slowly, for 1 ml, I am going to wait for like 10 seconds smoothly. And after that, after 10 seconds, withdraw the needle and put a gauze pad at the client's site where you injected, and make sure do not massage so that there is no damage of the tissue. And after that, discard all the things that we've been used, like the gauze pad, the cotton or the cotton balls or the syringe at the appropriate receptacle. And also, help the client in a comfortable position. Sir, i-close na ako, sir, ha?
Okay.
Pwede na ka mabalik sa sir. And after that, document the procedure.